climate and health learning series from St. Luke's. Really excited that we've got some IT issues sorted out, and we've got Dr. Debra Hendrickson here to present this month. Dr. Hendrickson is a board certified pediatrician in Reno, Nevada, which is the fastest warming city in the United States. She is the author of the outstanding book, The Air They Breathe, a pediatrician on the front lines of climate change, which you can see just behind her left shoulder there if you're interested. She is a clinical professor of pediatrics at the University of Nevada School of Medicine, where she lectures on the impact of early childhood experiences like poverty and trauma on long-term health. She has an honors degree in environmental studies from Brown University and was an environmental analyst and planner in New England and Seattle for 10 years before she attended medical school. Dr. Hendrickson has received many awards for academic achievement and research in both environmental studies and medicine, and she is a fellow of the American Academy of Pediatrics, a member of its Council on Environmental Health and Climate Change, and a founding member of Nevada's Clinicians for Climate Action, our sister organization to the Idaho Clinicians for Climate Action in Nevada. She has 3 grown children and 1 granddaughter that are the why for her work. Please take it away, Dr. Hendrickson.
Thank you, Ethan. Can everybody hear me okay? We're good? Okay.
Yes, okay, great. And we can see your slides.
Okay, great. So yeah, thank you everyone for coming back this week, and I'm sorry about all the technical difficulties, and thank you, Ethan, for that introduction. As Dr. Sims said, I'm here to talk to you today about a topic that's especially relevant this time of year, what I'm going to focus on. My book was about all the health impacts of climate change on children, but I'm going to focus today on wildfire smoke and the threat that it particularly poses to children's health, especially here in the West. In fact, I'm in Seattle right now. I'm not in Reno this week, and I drove up here a little over a week ago, and I got stopped by a wildfire in Oregon that suddenly broke out in a canyon in front of me. I had to backtrack 60 miles, so it seemed especially fitting for the talks I'm giving this week. And once I got here and looked west, the whole Olympic Peninsula was engulfed in smoke. So this is a very, big part of life in the West now. Wildfires have always been a part of the forest ecosystems here, but they're a much bigger problem than they were 2 decades ago, and that's largely due to climate change, as I'll show you. And as I've been traveling and speaking around the country about a range of diverse health impacts, concerning climate change, like I said, I've covered all of these things, but it was really wildfires and smoke that first pulled me into this issue because of where I live. As Dr. Sims mentioned, I live in Reno, which is the fastest warming city in the US. So it's not the hottest city. That's places like Phoenix and Las Vegas and Miami, but it's the place where temperatures are rising the fastest. And while we've definitely been seeing more heat waves in my town, the biggest impact we've seen is worsening air quality from wildfire smoke. We're 10 miles from the California border, so those are the Sierra Nevada mountains in the background there. And whenever a major fire erupts in those forests, we're directly downwind. So we've had weeks and even months of every summer and fall that look like this. That's that same viewpoint, and you can't see the mountains at all. And sometimes it's so bad that I can barely see across the street. Some of the worst crises we've had. So this is during the Carr and Mendocino complex fires in 2018. And whenever we get engulfed in smoke like this, the clinic and hospital fill with wheezing, coughing kids. This is a 4-year-old boy who I call Liam in the book, who got outside during the smoke crisis. And even though he had no history of asthma or lung problems, ended up in the hospital for several days on oxygen. And his story is also interesting because his mom had been exposed to smoke in 2013 Yosemite Rim fire during her first trimester of pregnancy. And while it's impossible to know if these problems were linked, he had a number of issues that have been tied to smoke exposure in utero, which I'll talk about in a minute. So one of the goals I had for today was to explain how a case like Liam's may have been linked to the much bigger global issue of climate change and why I think we all have a moral obligation to act. So how is his story tied to the global crisis of climate change? Well, ever since the dawn of the industrial age, when we first started burning coal for power, we've been pulling carbon from beneath the earth and pumping it into the atmosphere in the form of emissions from fossil fuels. So this is a graph that shows the concentration of CO2, carbon dioxide, in the atmosphere and the average surface temperature of Earth for the past 2,000 years, which is the period in which modern civilization has evolved. And you can see that they parallel one another because CO2 prevents the sun's energy from escaping back into space. It traps heat near the planet's surface. You can also see that we're living through, unprecedented times here at the end here. Our bodies and civilization evolved in a certain set of conditions, this atmosphere and this climate that are now rapidly changing. And that has huge repercussions for our health. So this is a list of some of the major health threats resulting from what's happening. And this is the spectrum of things that I was mentioning. The first that some people don't think about is infrastructure damage and loss. So many of the gains we've made in infant mortality and children's welfare over the past century have been due to improvements in public health like sewage treatment, water treatment, mosquito control programs, vaccines, of course, and many other similar efforts, pasteurizing milk. And the whole system that allows that to happen, of course, is our civilized world, hospitals, clinics, factories, government structure. But that's all endangered by a world that's going to be more chaotic and hotter and more prone to storms. Like just one small example, in Hurricane Helene in North Carolina, the factory that made 60% of IV fluids in the United States was badly damaged by that hurricane. And that created a nationwide IV fluid shortage, which I'm sure you dealt with at your hospital as well. The hospital in Paradise, California, from the Camp Fire in 2018 never reopened. A Memorial Hospital in New Orleans never reopened. So there are a lot of risks to just the healthcare infrastructure and infrastructure overall. Air quality, which I'm going to be focusing on today, wildfire smoke is increasing, urban ozone, which is a component of smog, allergens are increasing, heat illnesses, of course, the trauma of natural disasters and all the sequelae of that, more abuse and neglect in traumatized families, conflict and migration, certain infectious diseases are developing or increasing in prevalence, food and water insecurity, drought and famine, are rising in some places of the world. And then, of course, anxiety and depression or climate grief, which kind of overhangs all of this. And as I mentioned today, I'm going to be focusing primarily on wildfire smoke and also some of the ozone and allergen impacts of smoke, although those are problems on their own as well, and a little bit on heat and its relation to air quality as well. So one of the point I wanted to make early on is that even if fossil fuels were not causing global warming, they are a huge public health threat on their own. Every year, millions of premature deaths around the world are attributed to air pollution from fossil fuels. So there would be huge benefits to transitioning to clean energy just for that reason alone. But they are also, of course, causing global warming, which is further degrading air quality in the form of, as I mentioned, smoke, ground level ozone, and airborne allergens, all of which also worsen public health. So air pollution is both a cause and a consequence of climate change. And we're also seeing a feedback loop in which the wildfires are producing large amounts of greenhouse gases. And of course, air pollution is a risk for everyone, but it's but children face unique risks. And there's a long list of reasons for that. One important one is that their physiology is different. We often say in pediatrics that children are not just small adults. And what we mean by that is that a lot of the calculations and assumptions that we use to treat children are different than adults. And they're different in ways that make kids more susceptible to environmental harm. They're smaller, they breathe faster, and they have a larger relative lung surface area. So that means they're exposed to more air pollution per pound of weight. They're closer to the ground where pollutants settle. They tend to play outside more, and they tend to mouth breathe more, so they don't get the filtering benefits of the nose as much. The lining of their airways are more easily damaged, and that then allows certain pollutants like particulates to penetrate more easily deeper into the body. Detoxification systems in the body, especially in the liver and kidney, allow adults to do somewhat excrete toxins and repair some of the DNA damage they cause. These systems are not mature in children, and so they're more susceptible to harm. There's an expression in toxicology and in epidemiology, timing makes the poison, and it means that what it's referring to is that the younger you are, the more these types of events will affect you. So fetuses, babies, and toddlers are most at risk. And one of the reasons is that their organs and systems are still forming and growing. And this last point is especially important because children's bodies and minds develop through interaction with the world. The lungs and brain literally form through interaction with the air they breathe. Lung development is very badly affected by air pollution, as brain development, we now know, which of course also forms through a child's experiences and relationships. This brings up, one of the major themes of the book that I try to return to over and over again, which is that children's bodies and all of our bodies are inextricably linked to the atmosphere. Every time we take a breath or drink water, we're pulling the atmosphere into our bodies, and every cell of the body contains oxygen and water. So we literally carry the atmosphere within us, yet we never think about it. I mentioned, or Dr. Sims mentioned last week having me read an excerpt from the book. So I'm going to try and mix in a little bit of reading with the scientific part of the presentation. So this is, just to set it up, this is from the introduction, and it's after the Carr and Mendocino complex fires that I showed you a couple of slides ago had left us covered in smoke for weeks. And shortly after that, the city of Paradise had burned down in California. So we had a lot of refugees basically coming into the city to stay with family members. And shortly after the air cleared, I was walking from my clinic into the hospital to see kids in the pediatric ward. And you have to pass through this glass passageway in our hospital as you do that. And there's a garden down below. And I looked down and saw a little boy who I had just finished seeing in the clinic, who was down there with his mother and younger brother. And it was starting to rain, and the little boy was trying to catch a raindrop on his tongue. And I used that scene to try to explain how his body and his physiological processes are connected to everything else that I was looking at, that the atoms and molecules of water that are swirling around him might have flowed through him and many other living things around the world. So this is just a few paragraphs. Which meant that these elements were only borrowed from the atmosphere, not owned. That as he played, the breath he exhaled and the moisture evaporating from his skin, mouth, and lungs were rising back into the clouds to be carried away by the wind. That the water in the urine he voided that night before being tucked into bed would find its way, eventually, back to the sea. Because the water and air and heat that swirl around the globe, in clouds and rivers and oceans and wind, also flow through us and every living thing. The atmosphere outside the windows of the clinic and hospital, the backdrop to my patients' visits, is part of their bodies, physically linking them to this planet and all its life. Children are creatures of this world. What we do to the earth, we do to them. But children are attached to their world by more than water and air. When my young patient finally caught a raindrop, he threw his fists in the air and ran to his mother, who was sitting on a nearby bench. She smiled and hugged him, and he went limp with mock exhaustion, knowing she would not let him fall. The baby then squealed at being left out and waddled toward them like a tiny drunk. The older boy turned, crouched down, and tenderly hugged his brother, who had collapsed into his arms. "It's okay," I could see him saying. "It's okay." For a moment they were in a line, the mother's hands on her son's shoulders, him embracing his brother. Who could doubt, looking at them, that love passes through generations as surely as genes, linking us to everyone who came before and everyone who will follow? Who could doubt what science now proves and what I tell an audience of medical students every year when I lecture about early childhood? That the love we show our children, like the water they drink and the air they breathe, becomes part of their bodies, literally shaping their brains and hearts and futures. That same love, I hope, will save us, because it is the fiercest love that human beings feel. And no healthy parent, if they see their child is in danger, does nothing. So hopefully that gives you a little flavor, book. So, and part of the point of reading that is that, we may think in healthcare, or if you're in pediatrics, that the health of children, our patients, doesn't have much to do with forest management or the health of trees, but I hope to convince you in this talk that they're intimately related. I think we all know that growing wildfires are one of the most significant impacts of climate change. And what's interesting is that the number of wildfires per year in the US has been relatively stable. It's usually around 70,000 per year, and average year, at least 10% of those are in California. But what's happened is that the Western U.S. wildfires are, and in Canada as well, are growing more intense, larger in area, and longer in duration. And there are more than 100 studies now that have shown that climate change increases the weather conditions that are leading to this trend that lead to wildfires. We're seeing hotter, drier summers and falls, this kind of precipitation whiplash where there's very wet winters and springs followed by drought conditions for months, more extreme wind events, which tend to trigger wildfires as they did in LA in January, earlier snow melt and later snowfall, which leads to longer fire seasons. And there are other issues as well, like bark beetles in the western US are surging in these conditions. They love drought-weakened trees, so they're attacking and killing millions of trees. As you can see in this photograph from the Sierras, where over 100 million trees have died. Past fire suppression has led to fuel buildup in a lot of these areas. So when people raise the issue that this is a forest management issue, they're not 100% wrong. We've suppressed a lot of fires, and that has allowed these explosive conditions to worsen. And electric lines, our intrusion into the forests have triggered many of the fires as well. So these large fires over 100,000 acres are called mega fires. And this is the most significant trend we've seen. You can see that before 2000, these were rare events, especially before, 1980. They were extremely rare, and now they're extremely common. This is just showing California, and it doesn't even include the 2021 fires, which were really devastating and left my town in smoke, really terrible air for over 2 months. 18 of the 20 largest wildfires in California history have occurred since 2000. And this is a trend across the West, including Idaho. You can see that it's one of the most affected states. This is the change in annual burned acreage per square mile of land area. Last year, Idaho ranked 4th in the US for the number of acres burned, so over 430,000 acres. Large wildfires in the Northern Rockies are 10 times more common than they were in the 1970s. So California gets a lot of the headlines, but really this is a Western US and Canada problem. And that the result, of course, is that smoke from these fires is degrading air quality for millions of Americans. A study came out a couple of years ago that showed that smoke's contribution to daily PM 2.5, which are fine particulates, it's an air pollutant that we're going to talk a lot about today. In the Western US, the contribution of smoke to the levels of PM 2.5 has risen up to 5 micrograms per cubic meter. And many more people are experiencing at least one day a year of poor or hazardous air. The American Lung Association now says that 77 million people live in counties with an F grade for short-term particle pollution, which is almost always smoke. So this chart's a little bit difficult to interpret, but on the left here you have populations exposed. They're comparing 2 time periods, 2006 to 2010, and a decade later, basically. And this shows the change in the number of people exposed to terrible, really terrible air, over 200 micrograms per cubic meter. Bad air and just poor air. And you can see the terrible air increase has been the population exposed is an 11,000-fold increase, but they all increased. This is that same information put on a map to show that this trend is unraveling decades of progress under the Clean Air Act. The Clean Air Act was initially passed in 1970, and it's been updated multiple times since. But the trend after it was passed was a downtrend in all the major pollutants that were plaguing America. Particulates were going down until 2016, and then the trend reversed, and they have been trending up since. So this, you can see, is the worst areas are in the West, but Idaho also has some pockets of pretty bad degradation of air quality. The fires themselves are terrifying, and I tell a story in the book about a little girl who had to flee the Tubbs fire in Santa Rosa in the middle of the night, and her family lost everything. But smoke exposure is by far the greatest health impact of the wildfires. Injuries from fires, 2023 was a terrible year because of the Maui fires, which killed over 100 people, and the total death toll in the United States was 130. But wildfire smoke, looking at just the fine particulates in the smoke, has been blamed for over 52,000 excess California deaths between 2008 and 2018. I apologize for the noise. I'm in a little rental here in the middle of Seattle. So, but anyway, 52,000 deaths in a decade. So a huge number of morbidity and mortality from, this is just mortality from smoke, and they attributed over $430 billion of healthcare and economic costs to smoke exposure. Globally, over 1.5 million deaths per year are attributed just to PM 2.5 from wildfires. From all sources of PM 2.5, it's a much larger number, but just from wildfires, it's about 1.5 million people. More than 90% of those are in low and middle income countries because they don't have the ability, to use to seal up their homes and use air filters and some of the things we have here. This caption to the photo is just about a recent University of Washington study that showed mortality peaking in the day of the fire, the first few days afterward. But what is smoke? Like I've been mentioning particulate matter, but what does it consist of and why is it hazardous? We've all had the experience of sitting around a fire and having the smoke directed at us and wanting to get up and move. And it's a difficult thing to study because smoke is a very dynamic, mixed, material, and you can sample it in one location and a different location with the same fire and get different components. But the three big classes of pollutants in smoke are gases, particulate matter, and heavy metals and toxic chemicals. And I've noted here that 3 of the gases that are in most smoke, are in smoke, are also greenhouse gases, and that's that feedback loop I was talking about. But fine particulate matter and ultrafine are generally considered the most hazardous pollutants in the smoke. There's also literature on polycyclic aromatic hydrocarbons, volatile organic compounds like benzene, and then there's a lot of new research coming out of wildfire researchers, especially at Stanford, on the impact of heavy metals that are aerosolized by the smoke. But today I'm going to focus mainly on PM 2.5 because that's where the most research has been done. So particles, as I said, are generally considered the main threat in wildfire smoke. And what are they? These are microscopic solids and droplets that are derived from many different burned materials. Basically, anything that's in the path of the fire can be aerosolized as tiny particles. And they're often bound to heavy metals and toxic chemicals, those other smoke components I mentioned. The smaller the particle, the more invasive and dangerous to human health. And that's what this graphic is showing. You can see 2.5 here. 2.5 is the smallest particle regulated by law. Of course, it's very difficult to regulate the pollutants in wildfire smoke, but out of your car exhaust, out of factories, that's the smallest particle regulated by law. But wildfire smoke is packed with these very fine, 0.1 diameter particles that are especially dangerous because they can invade so easily through the lungs, into the bloodstream, and reach any organ of the body. And the adverse effects of them are due to what we call oxidative stress and inflammation. So they both inflame the area where they land and they cause a systemic inflammation in the body. They also, in children, appear to disrupt the normal developmental pathways of childhood. So if you picture a river heading down a canyon and maybe it hits an obstruction, it's going to take a different path. And that's kind of the idea here, that the particles can cause so much inflammation that they derail the normal pathways of development. And as I mentioned with that University of Washington study, this has been shown with fossil fuel pollutants and all kinds of particles. When particle levels rise in a city, so does the non-accidental death rate. So how many children are exposed to elevated PM 2.5 levels? Well, the EPA estimates that about a third of all the children in the US live in areas that have particle pollution above the standard. And this is particles from all sources, not just wildfires, but that's about 25 million children. There's a figure that's often cited that 7.4 million children per year are exposed to elevated PM 2.5 due to smoke, and that was looking at a 4-year period from 2008 to 2012. That's before a lot of the really major fires started hitting the West. Like the rim fire that I wrote about was the year after this, and every year after it got much worse in our town. So I think that 7.4 million figure is too low. This is just a photo. People talk a lot about California, but I know you in Idaho have seen smoke, but everywhere in the West has. This is a picture from the 2020, they're called the Labor Day fires. And over 450,000 children in King County, over 250,000 kids under 5 years old, which is the most vulnerable group, were exposed to hazardous levels of fine particulates during those fires. One of the questions about the health impacts of wildfires has been, how do they compare to the health impacts, the particles from wildfires versus the particles from fossil fuels? There's a huge amount of research on the negative health impacts of fossil fuel particles, but the exposure tends to be quite different. So the question was, is episodic but terrible exposure to particles better or worse than chronic but less severe? And I put together this little graphic just to sort of demonstrate this idea. When a smoke wave rolls through town, you've got this huge, very intense period of very high levels of particles. But then it goes away and the air can be pretty good on either side of it, whereas kids in cities are exposed chronically. And unfortunately, what a whole spate of new research in the last, 4 or 5 years has shown, as the fires have gotten worse, there's been a lot of new research on this, and it's shown that wildfire particles cause more inflammation and oxidative stress and are more toxic to the lung than fossil fuel particles. And there's a bunch of reasons for that, but it's not good news. And one study found that the same dose of wildfire particles would increase mortality more than the same dose of fossil fuel particles. And a multi-year study in San Diego County found that PM 2.5 from wildfire smoke was roughly 10 times more likely than particles from other sources to cause breathing problems in children. So the issue of which is more inflammatory has been answered, but the question is, are the long-term effects as bad? Oops, I think there's a researcher at Berkeley who does a lot of work on this, and he has stated unequivocally that no level of smoke exposure is safe because of this. The 24-hour average PM 2.5 limit under the health agency regulations, the World Health Organization recommends no more than 15 micrograms per meter cubed. EPA's is 35. When you see air like this in the West, you're looking at 250 to 500. And one researcher has pointed out that these limits are based on fossil fuel particles, and we now know that wildfire particles are so much worse. Should we be lowering the standard? And the other issue is, of course, that particles can travel thousands of miles. This is from that same event that I showed in the Seattle photo and the AQI map that I just, I didn't explain those the dark circles on the AQI map were from, of course, there was just indicators of terrible air. I'm sure most of you are familiar with the air quality index. So this is those fires broke out on September 9th, and by September 15th, you could map them, you could see them on NASA satellites across the entire country. So we're looking at, tens of millions, maybe hundreds of millions of people, especially in the northeast part of the country, who were exposed. And particles have been linked to many health problems in children. So I just broke these out basically from what the biggest areas of research that we've seen so far. And the top three are respiratory, perinatal, and neurodevelopmental. And I'm going to touch upon each of these. There are multiple other impacts as well. There's just not quite as much research on these, but it's pretty much that anytime somebody has looked at a health issue in pediatrics and said, does particle exposure make it worse? The answer has been yes. So kidney disease, diabetes, hypertension, obesity, certain pediatric cancers like leukemia, lymphoma, central nervous system tumors, certain gastrointestinal disorders like inflammatory bowel diseases, and atopic dermatitis. But I'm going to talk first about respiratory impacts and mainly asthma and the effect on lung development. But I did want to mention, since you guys are in a hospital system, bronchiolitis, RSV, COVID-19 and influenza have all been found to get worse and more prevalent in the presence of wildfire smoke. So just something to keep in mind. So pediatric respiratory visits and wildfires. We know that ER visits and hospitalizations for respiratory symptoms increase during and for days after exposure to wildfire particles. A large database from Northern California showed that asthma exacerbations increased 78% in the 2 weeks after the start of the 2018 Camp Fire. That's the Paradise, California fire. And the fire from that smoke swept into the Bay Area. So there were many, many children affected, and they had a lot of data. this affected all groups significantly, so there was no ethnic or income group that was not affected. And I think that's important to mention. But the greatest impact was on Hispanic and low income children. And anybody who's lived through these events knows that wildfire smoke is very egalitarian in its geography. It engulfs the entire city. There's nobody who escapes the impacts completely. But our response to it and the community's underlying vulnerabilities are not. So if your home is not well sealed, if you don't have air filters or a good HVAC system with a good filter on that, these are things that will increase the vulnerability of your child. And also, families who live in areas near major roads their kids are already more susceptible to asthma and going to be affected more by the smoke. So I want to talk a little bit about the impact of air pollution on lung development, because this is a very major concern. About 85% of lung growth happens after birth. And we know that air pollution from both animal studies and longitudinal studies of cohorts of children growing up in polluted neighborhoods, that air pollution disrupts normal lung development. So the architecture of the lung, the way that saccules turn into alveoli, the mechanics of the lung, the compliance of the lung, and the elastance of the lung, and lung immunity. And both particles, nitrous dioxide, and ozone have been all of those have been implicated most often. So we know from multiple studies from Los Angeles, from Boston, from Toronto, that children who are chronically exposed to elevated levels of ambient PM2.5 in urban environments have greater odds of lower FEV1 and FVC, which just means they have smaller, stiffer lungs, basically, and they're more prone to asthma and lower respiratory infections. And this has lifelong implications for their employability, for the kinds of health problems they're going to encounter later in life, and how long they're going to live. So do smoke waves have the same effect? This is, a burning question right now. We don't have a lot of evidence yet, but there are two studies that were not directly related, not human studies, but that give us some clue. Well, one was human, but it wasn't wildfire. Let me explain. So newborn monkeys were exposed to high levels of particles from a single 2008 California wildfire then they had impaired lung function and immunity in adolescence. So basically, the National Primate Center was in an area of California that was engulfed in smoke in this 2008 wildfire, and they had these newborn monkeys and said, let's see how this affected them long term. They went back when the monkeys were adolescents and found that they had a long-term impaired lung function and immunity from just that one wildfire event. So the other piece of evidence was from a coal fire, but it's another intense, terrible exposure. Children who were less than 2 years old, who were exposed to 6 weeks of elevated particulates from an Australian coal fire, had decreased lung function 3 years later. So this was, again, a situation where they had relatively good air on either side of this event, but the effect of the event persisted. We know that particles harms start before birth. Ultrafine particles cross the placenta, and there are higher maternal exposure leads to higher concentrations on the fetal side of the placenta. This picture is from a study done by Beauvais et al. In France, showing black carbon particles within the placenta. And prenatal exposure, very clearly, it's been demonstrated over and over again, increases the odds of preterm birth, intrauterine growth restriction, and low birth weight. Globally, about 2.5 million preterm births a year are triggered by particle pollution from all sources. So what's the contribution of wildfire smoke? Well, there was a large study of 5 million births in California for over a decade that showed that prenatal wildfire particulate exposure also increased odds of preterm birth, and that the strongest effect was in the second and third trimesters. Prenatal exposure may also increase the odds of birth defects. It's been associated with greater odds of congenital heart defects, cleft palate, gastroschisis, genitourinary system defects, and neural tube defects. And in most of these studies, exposure during the 3 months preconception and the first trimester are usually implicated. There have been a couple of studies now looking at just wildfire particulates to see if this relationship is holding true there too. A large study from Brazil found that prenatal wildfire particle exposure increased the odds of cleft lip and palate and some certain respiratory and nervous system malformations. And in California, this one study found that first trimester exposure increased the odds of spina bifida. That's, a neurological defect, a neural tube defect, by 43%. Some of the most alarming research, I think, and one that really fascinates me and upsets me most, is that particles very clearly now have been shown to injure children's brains. Like lung growth, most brain growth happens early. Most of it happens before age 3. We know now that particle pollution alters brain development through either direct invasion of the brain tissue through the nose or blood, or systemic inflammation. There are a series of studies out of Mexico City that have shown that children growing up in very polluted neighborhoods, that the particles are able to ascend or translocate up the olfactory nerve into the prefrontal cortex of the brain. And these kids and dogs as well in these neighborhoods had inflammation of the prefrontal cortex. And in autopsy studies of the population across the city, they've also found that people who have grown up in these areas have particles embedded in the prefrontal cortex encased in Alzheimer's-like plaques. So those researchers have been very alarmed by what it predicts about future Alzheimer's and Parkinson's disease in these kids. But there's also been studies showing increasing rates of autism, that exposure in especially prenatally is associated with increased odds of autism in early life, with ADHD, and I mentioned later dementia. Some of these studies have looked at the impact of co-occurring toxins like polycyclic aromatic hydrocarbons. So it's not just the particles themselves sometimes, but what they're adhered to. So I want to go back to Liam for just a second to just mention some of the issues he had. So he was born prematurely. He had a mild congenital heart defect that required a device closure. He had a genitourinary malformation. He had posterior urethral valves and hypospadias. He had a pretty significant speech delay and some developmental delay, ADHD, and he had a severe reaction to smoke exposure that landed him in the hospital. So that, I cannot say, and no one can say, that any of these problems were related to being exposed to smoke in the first trimester of his mom's pregnancy, or the fact that he's been exposed to smoke over and over again. But we can only know those questions by looking at large groups of people and comparing people exposed and people who weren't exposed, and we know that the rates of these things go up. And it's the difficulty of attributing these impacts to any one case that kind of shields the fossil fuel industry, because we can't point to Liam and say, this is something that you caused. And it makes it more difficult to make our case. It's only through the large studies. And I think it makes it more difficult for parents too, to appreciate exactly how much fossil fuels are harming their kids. Just wanted to go back to this slide for just a minute to just review. So we touched upon some of these things, premature birth, congenital malformations, and some of the neurodevelopmental impacts. Like I said, there's many, many more articles, and you could spend a whole lecture on any one of these topics easily. But if any of you want more information about the broader impacts, just let me know. So I wanted to move on from particulates and just say a little bit about ground level ozone, which is a major lung irritant and asthma trigger, also tied to the development of asthma in children. This is increasing in urban areas due to climate change. So this is a photo of Los Angeles, which of course is infamous for its smog. So ozone has been rising in many places, including in my town. But it's also an important product of wildfires. There are one study found that 2,400 pediatric asthma ER visits a year could be attributed to wildfire-generated ozone. And between 1997 and 2016, wildfires were found to be a factor in about 10% of high ozone days in the US. So it's not insignificant. Airborne allergens too. This is another problem that's increasing because of climate change. Allergens are like ragweed are increasing in range, potency, and levels. But smoke waves are also a contributor, or another factor in this, because they can trigger or worsen allergy symptoms in some people. Wildfires tend to release pollen and mold spores, and the particles in the smoke can adhere to the allergens, carry them deeper into the respiratory tract, irritate and inflame the airways, and increase a person's sensitivity to allergens. They also alter the immune response and act as an adjuvant for the allergen. So that's why they can make it worse. Heat waves are also an issue in air quality. Of course, this is just a screenshot of a recent high temperature in Boise. They're a major threat to children on their own directly, but they also cause problems because they worsen air quality. So heat waves are associated with high pressure systems that create stagnant air. They catalyze the formation of ground level ozone because ozone is, in heat, the formation of it goes up. And they increase the risk of wildfires. I don't know if this is the case in Boise, but in Reno, every heat wave, like clockwork, is followed by smoke. So they definitely make the forests more flammable. One hidden or indirect impact of these trends that I just wanted to mention is that hotter, smokier summers mean less outdoor time. The kids are going to be more sedentary on screens, and this increases the risk of long-term chronic health problems like obesity, diabetes, cardiovascular disease, and depression. And this is a photo of a Phoenix playground. A researcher from Phoenix who I interviewed in the book, Jennifer Vanos, did a study of Phoenix playgrounds and found that the surface of the playgrounds reaches 180 degrees in the summer. So they're really not usable for kids at all. And she's leading a movement to adopt natural playgrounds made of wood and fabric sails and trees to try to enable kids to get outside even in the hottest weather. I just wanted to touch upon the LA fires because there's a lot of really important new research coming out of those fires, which of course struck in January, burned over 38,000 acres and destroyed more than 16,000 structures. This is a Landsat photograph that shows the land changes as a result of the fires. Here's the Palisade fires. This is the Eaton Altadena fire. This is the Hearst fire. My family, my son and daughter-in-law and granddaughter live right there in the middle of this triangle. And I was down there during the fires trying to help families who were very worried about their children and the effect of the smoke on them. So researchers from UCLA, USC, Yale, Stanford, and Harvard, and I think there's a couple more. I think Davis is in there, UC Davis also, are conducting a long-term study on the air, water, and soil impacts of the fires, and they're monitoring residents' health over time. So this will be a very important study because these were, really classic examples of the urban forest interface where these fires start uphill of the urban area and then swoop down into the urban area and produce this extremely toxic smoke full of, paints and tires and everything that was in the homes. They're finding elevated levels of VOCs, particulates, and lead in the burned areas. And unfortunately, inside homes has been worse than outside homes. They are particularly concerned about the lead risk to children from the contaminated soil because more than 20% of the affected properties have had lead levels in the surrounding soil that exceeded the threshold. During the fires, airborne lead levels were more than 100 times over what's considered safe. So advice for parents, what can we all do in the immediate, when we're experiencing one of these fires? You can get the AQI app for your phone. This is an actual screenshot of my neighborhood from my phone in my neighborhood during the 2021 fires. I usually say if for children, healthy children, you want to stay indoors if it's over 100, be careful of exercise if it's over 50. You can get a very high grade filter for your central air conditioner if you have one. Air purifiers. This is the one I have many of these in my house. And the New York Times has a Wirecutter page that ranks them all for their ability to clear a room of particulates within 30 minutes. You can also make one yourself at home from instructions you can find online. If kids are old enough, they should wear an N95 mask if you're going outside in smoke. For babies, you can put a damp cloth over the baby seat. Air quality monitors. This is a purple air monitor. That's an outdoor one. You can get indoor ones, or these are not cheap either, so they're not an option for everyone. You can also get individual monitors that you clip on to see what you're exposed to. One inexpensive option that also helps families save energy costs is weatherizing the home, and a lot of municipalities have programs to help families do this. If you seal a home well to hold in your energy, reduce your energy costs, you're also sealing out particulates somewhat. So that can help as well. And then there's also adaptations that the state governments are making. We know that controlled burns, as opposed to these, explosive, intense mega fires, that those reduce the risks of the smoke. And so California, which is of course the state that's suffered the most from this, has invested $2.5 billion, and they're now treating over 700,000 acres a year with these controlled burns. And in recent fires, the treatments have significantly reduced the damage. And we have research showing that they produce, less smoke, less PM 2.5, and have fewer health impacts. So that's the way to go. And your Idaho governor has also called for changes in forest management, though I don't know as many details about that as I do about California. And then, of course, so those are adaptations we take now, but what can we do to keep this problem from getting worse? Well, the big categories we should all be trying to address in our own lives for reducing fossil fuel use are the electricity source we or our job or our kids' school uses, our transportation, food production and waste, and buildings. And there are many options, which I'm sure you're all familiar with, that we can take to try to reduce fossil fuel pollution and improve public health. And on the list over here on the right, also just voting, speaking, and joining groups like this who are concerned about the issue and working together for change. So that's it. Thank you very much.
Thank you so much, Deb. That was outstanding. I want to also steal a moment and just read a quote from your book that I'm going to patch together a few things from the introduction that I thought were particularly beautiful. So this is sort of 3 little sections that I highlighted that I wanted to read just to give people a sense of the messaging in the book. So it says, because while we think of climate change as a global problem, it is in fact a very personal problem multiplied many times. It is a threat to the people we love most, the children we hold in our arms and promise to keep safe. And later you say, children are the least powerful people in society. They can't vote, they have no money, the youngest can't speak for themselves, but they're telling us something we need to hear. They need their parents to join them and fight with the same fierce protectiveness we would feel if they were ill or injured or being bullied. We can't put them on a rocket ship to another planet, even if Elon wants us to. We must save this unique and beautiful planet that is their home. And finally, just Earth and humanity are in peril. Superman isn't coming. The only heroes our children have are us. I really thought that was, gives me a little goosebumps just even reading it. So I want to just ask first about the long-term impacts of wildfire smoke exposure, which you touched on a bit. I have been frustrated by this question as to kind of how much the dose of wildfire smoke exposure is needed to cause long-term damage to our lungs. And I understand the concept that no smoke exposure is the best approach, but that's not really possible if you live in Idaho or Nevada.
Right.
What do we think the best data says about the long-term impacts of development of things like COPD or asthma of these wildfire summers that we're all living through in the Northwest?
Yeah, so just based on wildfire smoke, not so. Yeah, like I said, we know from fossil fuel studies, there's a lot of long-term impact. We have very poor data so far on the long-term impacts of these smoke waves on kids' lung function, except for that animal study I mentioned and the coal fire study, which was just another example of a short-term, intense, high-level exposure. And they both indicated that a brief exposure could have impacts, several years later. What if that has impacts 10 years later? We don't know yet, we don't have the data yet on are we seeing just from kids who've been exposed just to wildfire smoke and not background urban pollution, what are the long-term effects? But I think there's a lot of concern because of all the evidence that these fires, that the particles are so inflammatory, and so toxic.
And to that end, there was a study just recently published that I wanted to ask you about. It was in the Lancet Planetary Health just this month, and the title was Quantifying the Short-Term Mortality Effects of Wildfire Smoke in Europe. So the findings of this study suggested that exposure to wildfire as a particulate matter, as opposed to other PM 2.5, those size particulates, had a higher risk of causing morbidity and mortality. What do you think the driving factor is behind that? Is it because the wildfire is coming along with the smaller particles? Is it just the makeup of the wildfire or something about it specifically?
Yeah, and that's been the thrust of all the like all the studies that have really appeared in the last 5 years about smoke have shown the mortality's high, morbidity's high, and that they're more toxic than fossil fuel particles. It's because of the high concentration of ultrafine particles that are so invasive and so inflammatory. Also because this is chemistry, but the polar organic carbon that's in them is very inflammatory. They have more free radicals, so there are a lot of chemical reasons. And they tend to, especially if they've involved urban areas, they have a lot of toxins in them. So that's the going theory about why, that they're actually chemically different, and the content is different in ways that make them more inflammatory.
You mentioned the development of children's lungs being impacted by exposure to wildfire smoke. Is that something that can be reversed later in life if you you move away from smoke, or if you do some other treatments? Is there something you can do, or are you kind of stuck with that situation if you're exposed to
Well,
wildfire?
yeah, again, we don't have the really long-term data. We have from several years out, it looks like it impacts them. But there's encouraging data from the fossil fuel research, because in the LA research that really started our understanding of how air pollution affects lung development, they did follow kids who moved from polluted neighborhoods into clean air neighborhoods. And if those kids moved during adolescence, which is a period of rapid lung growth, their lung capacity improved, their lung function improved 10 to 12%. So it's an argument both for, boy, what could we get out of just getting rid of gas-powered cars in these neighborhoods, and for just improving air quality in general. So the hope is, yes, that if you're in an area that just has these sporadic jumps in bad air, and then you have good air in between, that your lungs have some opportunity to recover as a child, and you do regain some of that capacity. But no one, that we don't have all that data yet.
I'm going to ask a question from the audience, and please, if anyone has questions, put them in the Q&A section, and I'll get them to Dr. Hendrickson here. Our school district cancels outdoor sports when the AQI reaches 151 or above, and they noticed that you suggested kids should stay inside when AQI is over 100. Their question is, should school districts change their policies? And my add-on to that is, how good is this data, both in terms of the AQI reading itself, and the science behind the AQI numbers? Just to expand on that a little bit, I was at a smoke conference last year and heard from some researchers in Montana who had looked at their AQI mapping, and I think there were 4 air quality monitors in the state of Montana. So an enormous state with just a few data points, and they got some funding and placed purple air monitors on every public school. And this allowed schools to have practices when they otherwise wouldn't be able to, because kids were being told they couldn't practice because the AQI was bad, but really their local air was pretty good. They just didn't have a monitor there to prove it. So how good is the data that we're getting that says what that number is actually real? And then how good is the data that says that 151 is safe, or 100 is safe, or where does that fall?
Yeah, well, that is a common problem, the spottiness of the air monitors, and that's why the purple air system has been so great, because you can download it on your phone and really look at what my neighborhood has so many people with them now, so you can really see on an almost block by block basis what the air quality is. So I think that's amazing that the school did that, and that's exactly what I would recommend to people to do, because yeah, the monitoring system is sparse in a lot of places, especially rural areas, that don't have a lot of urban development, and the EPA maybe wasn't worried about them 20 years ago. But the data behind the AQI, it's right. It's like I said, there are people who are quite critical of it now, especially from a pediatric standpoint, because of what we know about wildfire particles. This was based on, they really have no research that any level is safe or doesn't infect someone, so they tried to pick a level that affects some minimum number of people, on a cost benefit analysis, but that's all based on fossil fuel particles. So I would say if your AQI in your town is 100 from wildfire particles, we know those particles are 10 times more inflammatory than fossil fuel particles. I would just be super cautious, you know. Here, we've actually developed indoor areas for kids to, when the air's bad, to do soccer or sports. You know, Las Vegas has them for the heat, but we had some during the most recent terrible fires that people opened up with air filters so kids could go inside and do their sports indoors. So I don't think there's data because we hasn't studied it that well. You know, long term, like I said, we just don't know what the long term 10-year down the road impact is. We just know that morbidity and mortality, all these diagnoses go up when the levels are this high. And if you're out exercising and breathing that stuff deeply and pulling it into your body, I mean, I would just be super concerned as a parent. You hate to give people more to worry about, but I would err on the side of caution.
One thing I love about your book is that, um, like, in addition to the beautiful stories you tell about all these kids who have had, like, clear examples of how climate has impacted their health, you end by talking about solutions. And I think that's what people really are desperate for, is how can we reverse this problem? And one thing I fear is the complexity of the problem paralyzes people from taking any action because it feels like such an overwhelming problem to solve that people can't uh, do it themselves. And so it's
Right,
better just to kind of put your head in the sand and don't do anything.
right.
How do you recommend we communicate the simple steps people can do in their lives that can really make an impact? And what are some examples of those things you'd recommend people do?
I tell people to try to think of your life as being in the center of a series of spheres. You know, like your home, your family, your car is kind of the center. Maybe the next sphere out is your school and your workplace, and then your neighborhood, your city, your county, your state, your country. And just try to think of just one thing you can do at the center or the next level. You know, for if you have children, getting them involved in a project at school, like is there money, are there funds available still for an electric school bus in your school district? Are there funds available to switch out the old HVAC system and put solar panels and heat pump on your school? And that gets kids involved too, especially kids who are old enough to understand this problem. You know, it gives them something to do. I think action is the antidote to despair, and breaking it down into just something small you can do. And I think each action tends to build on itself. And if you're doing it with other people too, that really is motivating and builds momentum. So, you know, my attitude is the same as the IPCC's, you know, the Intergovernmental Panel on Climate Change. They have a famous slide that every tenth of a degree matters, every pound of carbon matters, every action matters. So do something, no matter how small, and you might find yourself doing something else and just feeling more empowered from it.
Yeah, and I love the concept of Catherine Hayhoe that talking about it is the most
Yeah.
important thing, because
Hmm.
I think normalizing this as a societal problem that we can fix
Right.
makes it easier for people to try to fix it. Um,
Yes.
uh,
And oh, go ahead.
but
Sorry. I was just going to say, and I always try to point out to people too that, you know, the despair and doom kind of feeling is something that the fossil fuel industry has really tried to promote. And I don't know if you've read Michael Mann's book, The New Climate War, but he talks about this, that this is actually a strategy of theirs. And you know, so things like that, I find that a certain amount of constructive anger is really good too, just because anger is an energizing emotion, along with constructive hope, that not a Pollyanna kind of hope, but a hope that we can do something about this. That, you know, it's okay to be really angry that somebody made the decision to pump billions of tons of carbon into the air and into our shared air, you know, which is while they profit from their business, and that we all have to face the consequences of that. So, yeah, so I just find that helpful too. But
yeah, powerful. So one last question. Thank you so much for sharing this information and these insights, Dr. Hendrickson. I wonder what local or state policy initiatives seem most promising to you for health professionals to fight for in these times. And I would add to that with a question about Nevada's recent push to develop outdoor working heat standards and how other Western states can follow that policy.
Yeah, I wasn't one of the leaders on that, but that was one of the major accomplishments we had this year. And we're going to be posting our legislative accomplishments on our website soon so that everybody can see. That was one. Another one was protecting outdoor workers from wildfire smoke. Yeah, I think the categories of action fall into two, it's adaptations to protect our patients now, and then things we can do to prevent the problem from getting worse. So for adaptations, things like the legislation we got passed to protect outdoor workers when conditions reach a certain threshold, they have to be given water, they have to be given breaks. Over certain thresholds, they can't work. And the wildfire legislation is constructed somewhat similarly. So for adaptations, things like the legislation.
And my understanding is that studies have shown that those policies have actually led to increased productivity and profitability of businesses when outdoor workers are given those protections.
I'm not, yes, that's true. And I'm not surprised, because if you've ever tried to work in that, I can't even go for a hike in that kind of temperature, it's so awful. And you see these guys out, pouring asphalt in full, jeans and hard hats and vests in over 100 degrees. It's really hazardous. So that's one category. And then the other category is, reducing greenhouse gases. So if your community has a sustainability plan, that's a really good thing to get involved with. If they don't, you can start to work on one about what things can your community, your household, your town, your neighborhood, what can you do at each of these levels to try to reduce greenhouse gases? I go through more of them in the book.
Yeah, well, it's an outstanding read, and I would encourage everyone to have a look. I want to thank you so much for your time and wisdom, Dr. Hendrickson. And I want to let people know our upcoming talks. I'm just going to get my calendar up so I can say for sure. On September 17th, we have a pediatric surgeon from Rush University Hospital in Chicago, Illinois, named Dr. Ami Shah, who's going to talk about greening the operating room and some strategies that they have been successful with at decreasing waste and energy inefficiencies in operative settings without impacting the quality of their care. And then on October, I think it's the 8th. Yes, on October 8th, Dr. Lisa Patel, another pediatrician, will be joining us to talk about her career in the climate and health space and some more details about ways to become involved and impact this climate and health space. So a couple of great talks coming up. And go ahead.
I was going to say reducing emissions from healthcare facilities, of course, and waste from healthcare is a huge category for you guys too, because you're in a hospital setting.
Yeah, so that's the sphere I'm trying to work in. So find the sphere you're comfortable making your impact. I love that concept, and I hope we can all take that with us today. So thanks so much for your time and everyone for your attendance. Please look out for a post-session survey that should be coming out right now, and give us some feedback on how these talks are going. Thank you again, Dr. Debra Hendrickson.
Thank you guys, all of you. Thank you, Dr. Sims.